नमस्ते बिटिया, हमेशा खुश रहो बिटिया। I am Dr. Bharat Sharma, Assistant Professor, Department of Pathology, Faculty of Homeopathic Science, JAYOTI VIDYAPEETH Women's University, Jaipur. Today's topic is nephritic syndrome. The nephritic syndrome is a clinical complex, usually of acute onset, characterized by hematuria with dysmorphic red cell and red cell cast in the urine, some degree of oliguria and azotemia, and hypertension. Although proteinuria and even edema also may be present, these usually are not as severe as in the nephrotic syndrome. The lesions that cause the nephritic syndrome have in common proliferation of cells within the glomeruli, often accompanied by an inflammatory leukocytic infiltrate. This inflammatory reaction severely injures the capillary walls, permitting blood to passes into the urine and inducing hemodynamic changes that leads to the reduction in the glomerular filtration rate. The reduced glomerular filtration rate is manifested clinically by oliguria, fluid retention, and azotemia. Hypertension probably is a result of both the fluid retention and some augmented renin release from the ischemic kidney. The acute nephritic syndrome may be produced by systemic disorders. Examples are systemic lupus erythematosus, or it may be secondary to primary glomerular diseases. The latter is exemplified by acute post-infectious glomerulonephritis. Causes of acute nephritic syndrome are: first is primary glomerulonephritis. Acute glomerulonephritis in post-streptococcal, non-streptococcal, rapidly progressive glomerulonephritis, membranoproliferative glomerulonephritis, focal and diffuse proliferative glomerulonephritis, immunoglobulin A nephropathy. Systemic diseases that can cause nephritic syndrome are systemic lupus erythematosus, polyarteritis nodosa, Wegener's granulomatosis, Henoch Sconnellian purpura, cryoglobulinemia. These are the contrasting features of acute nephritis and nephrotic syndrome. Proteinuria is mild in acute nephritic syndrome, while heavy in nephrotic syndrome. Hypoalbuminemia is uncommon in acute nephritic syndrome, while present in nephrotic syndrome. Edema is mild in nephritic syndrome, while marked in nephrotic syndrome. Mechanism of edema: sodium and water retention, while in nephrotic syndrome it is decreased plasma oncotic pressure and sodium and water retention. Hematuria is present in nephritic syndrome while absent in nephrotic syndrome. Hypertension is present in nephritic syndrome. It is also present in nephrotic syndrome but in advanced cases. Hyperlipidemia is absent in nephritic syndrome and present in nephrotic syndrome. Lipiduria is absent in nephritic syndrome and present in nephrotic syndrome. Oliguria is present in nephritic syndrome. It also present in nephrotic syndrome, but in advanced cases. Hypercoagulability is absent in nephritic syndrome while present in nephrotic syndrome. Pathophysiology. The pathophysiology of nephritic syndrome is dependent on the underlying disease process, which can vary depending on what condition the nephritic syndrome is secondary to. More specifically, different diseases, many of which are mentioned above in the causes section, affect different segment of the glomerulus and cause disease-specific segments of the glomerulus to become inflamed. Most often, it is dependent on what part of the glomerulus is damaged by antibody antigen complex, immune complex deposition. In all cases, however, the inflammatory process in the glomerulus cause the capillary to swell and the pores between podocytes become large enough that inappropriate contents in the blood plasma, that is red blood cells, protein, etc., will begin to spill into the urine. This causes a decrease in glomerular filtration rate and is left untreated over time will eventually produce uremic symptoms and retention of sodium and water in the body, leading to both edema and hypertension. Nephrotic syndrome has symptoms like hematuria, blurred vision, hypertension, oliguria, azotemia means abnormally high level of nitrogen containing agents, and proteinuria. This session is powered by Digital Version 2.0, Jyoti Vidyapeeth Women's University. I hope you all enjoy this session. If you have any query, please mention it in comment box. Thank you.